Did you know that poor circulation could be quietly sabotaging your health without you even realizing it? From cold hands and feet to serious complications like heart disease, poor blood flow is a silent disruptor that we often overlook. Poor circulation can lead to a range of serious health issues, such as heart disease, tissue damage, and even limb loss. It can contribute to fatigue, skin problems, and in severe cases, life-threatening conditions like stroke or heart attack. The most alarming part? It often goes unnoticed until it's too late. Many of us brush off symptoms like cold extremities or tingling as minor annoyances, but these could be signs of a much bigger issue lurking beneath the surface. In this video, we're going to break down the hidden dangers of poor circulation, uncover the most common causes, and walk you through effective solutions. By the end, you'll have a clear understanding of what steps you can take to improve your blood flow and protect your health, whether it's through dietary changes, exercises, or supplements. Before we jump in, don't forget to hit that subscribe button and turn on notifications so you never miss a new video. And as we go along, feel free to share any personal experiences or questions you have in the comments below. Your insights could help someone else on their health journey too. Causes of poor circulation. When it comes to poor circulation, understanding the underlying causes is essential to addressing the issue and preventing further complications. Circulation problems don't just happen overnight, they often develop due to multiple factors, many of which are interconnected. Let's explore the primary causes in greater detail, shedding light on how each factor plays a critical role in your blood flow and overall health. Heart problems. Your heart is the powerhouse of your circulatory system, responsible for pumping blood to every corner of your body. When your heart is compromised, the consequences can be serious. Heart conditions like heart failure, coronary artery disease, and arrhythmias directly impact the body's ability to circulate blood efficiently. For instance, in the case of heart failure, the heart weakens and struggles to pump sufficient amounts of blood, causing a ripple effect throughout the body. Organs and tissues begin to suffer from a lack of oxygen and nutrients, which, over time, can lead to chronic fatigue, muscle cramps, swelling, especially in the lower extremities, and, in severe cases, organ failure. Coronary artery disease, one of the leading causes of heart attacks, happens when the arteries supplying blood to the heart muscle become narrowed or blocked by plaque buildup. This restricts the heart's ability to receive the blood it needs to function, making it even harder to pump blood to the rest of the body. Furthermore, arrhythmias, or irregular heartbeats, can disrupt the heart's rhythm, making blood circulation erratic and inefficient. Even if your heart is only slightly out of rhythm, it can still have a significant impact on blood flow, particularly to the brain and limbs, leading to symptoms like dizziness, shortness of breath, and cold hands and feet. Blood vessel issues. The condition of your blood vessels, specifically your arteries and veins, plays a crucial role in circulation. Healthy vessels allow for smooth, unobstructed blood flow. However, certain conditions can cause blood vessels to narrow or become blocked, restricting the movement of blood and leading to poor circulation. Atherosclerosis, for example, is a condition where plaque, a combination of cholesterol, fat, and other substances, builds up inside the arteries. Over time, this buildup narrows the arteries, significantly reducing the amount of blood that can pass through. This limits the oxygen and nutrients that reach your vital organs and muscles, leading to issues such as heart disease, strokes, and peripheral artery disease, PAD. PAD, in particular, affects the arteries that supply blood to the legs and feet. As these arteries narrow, the amount of blood that reaches the lower extremities decreases, leading to symptoms like leg pain when walking, slow-healing wounds, and, in extreme cases, tissue death. Blood clots present another serious risk. When a clot forms in an artery, it can completely block blood flow, causing immediate tissue damage in the affected area. If a clot forms in a vein, such as with deep vein thrombosis, DVT, it can lead to swelling, pain, and potentially life-threatening complications like a pulmonary embolism if the clot travels to the lungs. Similarly, varicose veins, though often seen as a cosmetic issue, can impede circulation in the legs, leading to aching, swelling, and an increased risk of blood clots. Blood problems. The health of your blood itself is another major factor affecting circulation. High cholesterol, for example, leads to the buildup of fatty deposits in the arteries, contributing to atherosclerosis and further narrowing of the blood vessels. This not only limits blood flow but also increases the risk of serious events like heart attacks or strokes. Beyond cholesterol, low iron levels, which lead to anemia, also impact circulation. Iron is crucial for the production of hemoglobin, a protein in red blood cells that carries oxygen throughout the body. When iron levels are low, your body can't produce enough healthy red blood cells, and as a result, your tissues don't get the oxygen they need to function properly. This causes symptoms like fatigue, weakness, and cold extremities, all signs of poor circulation. Additionally, blood disorders such as diabetes can severely affect circulation. High blood sugar levels damage blood vessels over time, leading to a narrowing of the arteries and reducing blood flow, particularly to the extremities. Diabetic patients often experience circulation problems in their legs and feet, which can lead to slow-healing wounds, infections, and in extreme cases, amputations. Keeping blood sugar levels under control is critical for preventing further vascular damage and improving circulation. Blood pressure. Blood pressure, whether too high or too low, can have a dramatic effect on circulation. High blood pressure, also known as hypertension, puts extra stress on the walls of your blood vessels. Over time, this pressure can damage the arteries, making them less flexible and more prone to blockage. This, in turn, makes it harder for blood to circulate efficiently, leading to poor circulation and increasing the risk of heart disease, strokes, and kidney failure. On the flip side, low blood pressure can also cause circulation problems. When blood pressure is too low, there isn't enough force behind the blood flow to push it through the arteries and veins, particularly to the extremities like the hands and feet. This can lead to symptoms such as dizziness, lightheadedness, and cold extremities due to the lack of blood reaching those areas. Both high and low blood pressure need to be managed carefully to maintain optimal circulation. While lifestyle changes like a balanced diet, regular exercise, and stress management can help control blood pressure, medication is sometimes necessary to keep it within a healthy range. Signs of poor circulation. After understanding the causes of poor circulation, recognizing the symptoms early is essential to preventing long-term health problems. Poor circulation can manifest in subtle ways that are easy to overlook. However, these signs can be your body's way of telling you that something isn't right. Ignoring these symptoms can lead to serious complications, so it's crucial to know what to watch out for. Let's break down the key signs of poor circulation, from physical symptoms to potential complications, and why medical evaluation is so important. Physical symptoms. The first and often most noticeable signs of poor circulation are physical. These symptoms are often localized in the extremities, your hands, feet, and legs, because these areas are furthest from the heart, making it harder for blood to reach them when circulation is compromised. One of the most common symptoms is coldness in the extremities, particularly in the hands and feet. If your fingers and toes frequently feel cold, even in warm environments, this could indicate that blood isn't flowing efficiently to these areas. Poor circulation means less oxygen is reaching these tissues, leading to that chilly sensation. You may also notice tingling or numbness in the same areas. This occurs because the nerves, which rely on a steady supply of blood to function properly, are not receiving enough oxygen and nutrients. The result is that pins and needles feeling, or complete numbness in severe cases. Other signs include hair loss and dry skin. Poor blood flow can weaken the hair follicles, causing your hair to fall out, particularly on your legs and feet. Similarly, the skin on your extremities may become dry and flaky, as it's not receiving the hydration and nutrients it needs to stay healthy. If you have slow-healing wounds, this is another red flag. When circulation is poor, your body struggles to deliver the necessary immune cells and nutrients to repair damage, leading to wounds that take much longer than usual to heal. This is especially dangerous for people with underlying conditions like diabetes, as untreated wounds can lead to infections and even amputations in extreme cases. Beyond these surface-level symptoms, other indicators can be more subtle but just as significant. Brittle nails can signal circulation issues, as the reduced blood flow can weaken the nails, causing them to crack or break easily. Even erectile dysfunction can be linked to poor circulation, as the condition requires healthy blood flow to the reproductive organs. In men, circulation problems can restrict blood flow, leading to difficulties in maintaining an erection, which is often an early sign of underlying vascular issues. Serious complications. If poor circulation is left untreated, it can lead to much more serious complications that go beyond minor physical discomfort. One of the most concerning issues is nerve damage. Nerves rely on a steady supply of oxygen-rich blood to function correctly, and when they don't receive it, they can become permanently damaged. This is why people with poor circulation often experience numbness or tingling, but in severe cases, they may lose sensation entirely in certain areas of their body. Another potential complication is tissue damage. When blood flow is restricted for an extended period, tissues begin to die from a lack of oxygen. This is particularly dangerous for people with diabetes, who are already at a higher risk of poor circulation. In these cases, tissue death can lead to diabetic ulcers, particularly on the feet. These ulcers are not only painful but can become infected and may require amputation if left untreated. One of the most serious conditions related to poor circulation is peripheral arterial disease, PAD. This occurs when plaque builds up in the arteries that supply blood to your limbs, causing them to narrow and reducing blood flow. PAD can cause severe pain, especially when walking, and if the blockage becomes complete, it can lead to tissue death and possible limb amputation. PAD also increases your risk of heart disease and stroke, making it a condition that requires immediate medical attention. Another major risk is the development of blood clots, which can block arteries and veins, leading to potentially life-threatening conditions like a pulmonary embolism if the clot travels to the lungs. Blood clots often form when blood flow is slow or stagnant, which is why poor circulation increases your risk of developing them. Clots can cause swelling, pain, and other symptoms, but in some cases, they may not present any signs at all until they cause a serious medical emergency. Importance of medical evaluation. If you're experiencing any of these symptoms, even if they seem minor, it's important to seek medical evaluation as soon as possible. Poor circulation can be a sign of a serious underlying condition, such as heart disease, diabetes, or PAD, all of which require timely intervention to prevent further complications. A healthcare professional can help you identify the root cause of your circulation problems and recommend treatments that can improve your condition and prevent long-term damage. Medical professionals may use tests like a Doppler ultrasound to measure blood flow in your arteries and veins, or an ankle brachial index (ABI) to check for PAD. Depending on the severity of your symptoms, treatment options may range from lifestyle changes like increased exercise and dietary modifications to medications that help improve circulation or even surgical interventions for more serious cases. Without proper diagnosis and treatment, poor circulation can lead to irreversible damage, so early detection is key. Taking action for your health. Recognizing the signs of poor circulation is the first step toward protecting your health. The sooner you address the problem, the better your chances of preventing serious complications like nerve or tissue damage, blood clots, and amputations. By paying attention to physical symptoms such as cold extremities, tingling, slow-healing wounds, or hair loss, and seeking medical evaluation when needed, you can take control of your circulation and overall well-being. Incorporating lifestyle changes like regular exercise, a balanced diet, staying hydrated, and managing underlying conditions like diabetes or high blood pressure can go a long way in improving circulation. Ultimately, understanding the signs and taking action early is crucial to maintaining optimal health and preventing long-term complications. Vitamins and supplements for improved circulation. Maintaining optimal circulation is vital for overall health, and while lifestyle changes like exercise and a balanced diet play a big role, certain vitamins and supplements can provide a natural boost to your blood flow. These supplements help by enhancing vessel function, reducing inflammation, and improving the ability of your blood to transport oxygen and nutrients efficiently throughout your body. Let's dive deeper into some of the most effective supplements for promoting better circulation. Vitamin B3, niacin. Vitamin B3, or niacin, is well known for its ability to improve circulation by dilating blood vessels and boosting blood flow. One of its key benefits is its role in reducing bad cholesterol, LDL, while increasing good cholesterol, HDL, helping to prevent artery blockages that can impede circulation. When blood vessels expand, a process known as vasodilation, they allow more oxygen and nutrients to be delivered to muscles, tissues, and vital organs. This makes niacin particularly beneficial for individuals with atherosclerosis, where the arteries become hardened or narrowed due to plaque buildup. Niacin can be naturally obtained from foods like poultry, meat, fish, and whole grains, or through supplements. Be aware, though, that high doses of niacin supplements may cause a temporary side effect known as niacin flush, a sensation of warmth or tingling on the skin, so it's best to consult with a healthcare provider for the right dosage. Curcumin. Curcumin, the active ingredient in turmeric, has powerful anti-inflammatory and antioxidant properties. Inflammation in the blood vessels is one of the leading contributors to poor circulation, and curcumin helps reduce this inflammation, improving vascular function. Studies show that curcumin may benefit those with chronic conditions like diabetes and cardiovascular disease, which are often associated with compromised blood flow. It also plays a role in preventing blood clots by improving the function of the endothelium, the thin layer of cells that line blood vessels. Regularly incorporating turmeric into your meals or taking curcumin supplements can promote better circulation. For improved absorption, it's often recommended to combine curcumin with black pepper, which contains piperine, a compound that enhances curcumin's bioavailability. Beet supplements. Beets are an excellent natural source of nitrates, compounds that the body converts into nitric oxide. Nitric oxide is essential for relaxing and widening blood vessels, vasodilation, allowing for improved blood flow. This can be particularly helpful in reducing blood pressure and enhancing oxygen delivery to muscles during physical activity, making beets a favorite among athletes for boosting endurance and performance. Consuming beetroot juice or beet supplements can significantly enhance circulation, especially in individuals with high blood pressure or those at risk for cardiovascular diseases. Beets are also rich in antioxidants, which protect blood vessels from damage caused by free radicals. Garlic. Garlic has been used for centuries as a natural remedy for improving heart health and circulation. Allicin, a sulfur compound in garlic, is responsible for its heart-healthy benefits. Garlic helps lower blood pressure by relaxing blood vessels, which makes it easier for blood to circulate. Studies suggest that regular consumption of garlic can lower the risk of developing plaque in the arteries and reduce the likelihood of blood clots forming, which improves overall blood flow. Whether consumed raw, cooked, or in supplement form, garlic is a powerful tool for maintaining cardiovascular health and improving circulation. Its anti-inflammatory properties also help protect blood vessels from oxidative damage, further promoting healthy circulation. L-arginine. L-arginine is an amino acid that the body uses to produce nitric oxide, a molecule that helps relax and dilate blood vessels. This increased nitric oxide production leads to improved circulation, especially in the arteries supplying blood to the heart. L-arginine can be especially beneficial for people with conditions that impair circulation, such as peripheral arterial disease, PAD, or angina, chest pain due to reduced blood flow to the heart. You can find L-arginine in protein-rich foods like meat, poultry, fish, and dairy, but supplementation is also an option for those looking to boost circulation further. It's particularly popular among athletes and those with cardiovascular concerns, as it promotes increased blood flow and supports vascular health. Capsaicin. Capsaicin, the compound responsible for the spiciness of chili peppers, is another powerful circulatory booster. Capsaicin stimulates blood flow by dilating blood vessels and increasing circulation to various parts of the body, including the extremities. Capsaicin's vasodilating effects can be especially helpful for people who experience cold hands and feet due to poor circulation. In addition to promoting better blood flow, capsaicin is known for its pain-relieving properties and can be used to treat conditions like arthritis or neuropathy. It also helps lower cholesterol levels and reduces the risk of plaque formation in the arteries, further enhancing cardiovascular health. Adding chili peppers or capsaicin supplements to your diet is a great way to spice up your meals while boosting circulation. Omega-3 fatty acids. Omega-3 fatty acids, found in fatty fish like salmon, mackerel, and sardines, are essential for heart and vascular health. They help reduce inflammation in the blood vessels, prevent blood clot formation, and lower triglyceride levels, all of which contribute to improved circulation. Omega-3s are also known for their ability to lower blood pressure and increase levels of good cholesterol, HDL, further enhancing blood flow and reducing the risk of heart disease. For those who don't consume enough fish, omega-3 supplements like fish oil or algae oil, for vegetarians and vegans, are a great alternative. Incorporating omega-3s into your routine not only supports healthy circulation but also provides additional benefits like improved brain function and reduced risk of chronic diseases. Lifestyle changes for improved circulation. While vitamins and supplements can provide significant support for improving circulation, adopting certain lifestyle changes can enhance the effectiveness of these remedies and lead to lasting benefits for your cardiovascular health. These changes encompass physical activity, dietary adjustments, and healthier habits that collectively contribute to better blood flow. Here's a deeper look at some key lifestyle changes that can help improve circulation. Exercise. Engaging in regular cardiovascular exercise is perhaps the most effective way to enhance circulation. Activities like walking, running, cycling, and swimming not only strengthen the heart but also improve the efficiency of the cardiovascular system. When you exercise, your heart pumps more vigorously, increasing blood flow to the muscles and organs. Over time, this improves the flexibility and strength of blood vessels, making them more adept at delivering oxygen and nutrients throughout your body. Incorporating interval training, alternating periods of intense effort with periods of lower intensity activity, can further boost circulation and cardiovascular fitness. Even simple activities like taking the stairs, gardening, or dancing can contribute to overall physical activity levels, leading to better circulation and heart health. Compression socks. For individuals experiencing swelling, varicose veins, or chronic venous insufficiency, wearing compression socks can be a game changer. These specially designed socks apply graduated pressure, which means they are tighter at the ankle and gradually loosen as they go up the leg. This design promotes venous return, helping blood flow back to the heart and reducing the pooling of blood in the lower extremities. Compression socks can be especially beneficial for those who spend long hours sitting or standing, such as office workers or frequent travelers. Additionally, they can help alleviate discomfort associated with swelling during pregnancy or long flights. Balanced iron levels. Iron is crucial for producing hemoglobin, the protein in red blood cells that carries oxygen throughout the body. Low iron levels can lead to anemia, characterized by fatigue, weakness, and poor circulation. To maintain balanced iron levels, consider incorporating iron-rich foods into your diet, such as red meat and poultry, excellent sources of heme iron, which is more easily absorbed by the body. Leafy greens, spinach, kale, and collard greens are rich in non-heme iron and can be combined with vitamin C-rich foods, like citrus fruits, to enhance absorption. Legumes, beans, lentils, and chickpeas are also great sources of iron, making them ideal for vegetarians and vegans. If you suspect you may be iron deficient, consider consulting with a healthcare professional for proper testing and potential supplementation. Tea. Both green and black teas are packed with antioxidants, particularly flavonoids, which have been shown to improve circulation and reduce the risk of cardiovascular disease. Regular consumption of these teas can help relax blood vessels, lower blood pressure, and reduce inflammation. Green tea, in particular, is rich in epigallocatechin gallate, EGCG, a powerful antioxidant that has been linked to improved endothelial function, the health of the thin layer of cells lining the blood vessels. Incorporating a cup or two of tea into your daily routine can be a simple yet effective way to support your circulation. Yoga. Practicing yoga not only enhances flexibility and strength but also promotes relaxation and stress reduction, both of which can contribute to improved circulation. Specific poses, such as downward dog, legs up the wall, and mountain pose, help stretch and engage various muscle groups, stimulating blood flow to the extremities. In addition, yoga encourages deep breathing, which can enhance oxygen delivery to tissues and promote a sense of calm, reducing stress hormones that can constrict blood vessels. Many people find that a regular yoga practice leads to increased energy levels and better overall circulation. Quit smoking. Smoking is one of the most detrimental habits for cardiovascular health, as it causes immediate and long-term damage to blood vessels. The toxins in cigarette smoke can lead to atherosclerosis, the buildup of plaque in arteries, significantly impairing circulation and increasing the risk of heart disease, stroke, and peripheral artery disease. Quitting smoking can greatly improve circulation, enhance lung function, and promote overall cardiovascular health. If you're struggling to quit, consider seeking support through counseling, support groups, or smoking cessation programs, which can significantly increase your chances of success. Hydration. Proper hydration is essential for maintaining healthy blood volume and viscosity. When you are dehydrated, your blood can become thicker, making it harder for your heart to pump effectively and reducing overall circulation. Aim to drink plenty of water throughout the day, adjusting your intake based on activity level, climate, and individual needs. Herbal teas and foods with high water content, such as fruits and vegetables, can also contribute to your hydration goals. Staying adequately hydrated supports optimal blood flow and helps prevent complications like blood clots and varicose veins. Leg elevation. Elevating your legs above the level of your heart is a simple yet effective way to promote better circulation, particularly if you experience swelling or discomfort in your lower extremities. This position helps reduce pressure in the veins, allowing blood to flow more freely back to the heart. You can elevate your legs while resting on a couch or bed, propping them up with cushions or a wedge. Try to incorporate leg elevation into your daily routine, especially after prolonged periods of sitting or standing. Fatty fish. Incorporating fatty fish like salmon, mackerel, and sardines into your diet is a delicious way to boost your intake of omega-3 fatty acids. These healthy fats are renowned for their anti-inflammatory properties, which can enhance blood vessel health and circulation. Omega-3s also help lower triglyceride levels, reduce blood pressure, and prevent the formation of clots, all contributing to improved cardiovascular function. Aim for at least 2 servings of fatty fish per week or consider omega-3 supplements if you don't consume fish regularly. This simple dietary addition can have significant positive effects on your circulation and overall heart health. In this video, we've discussed the causes, signs, and solutions for poor circulation. From heart issues to blood vessel blockages, we've explored the key factors that can affect your blood flow. We've also covered the role of vitamins, supplements, and lifestyle changes in improving circulation. Remember to share this video with your friends and family if you found it helpful, and leave a comment below with any questions or personal experiences. Don't forget to subscribe for more health and wellness tips. For more information on poor circulation, check out the links in the description to related articles and resources.